This is Derek, and I'm going to tell you all about the results and recall systems in this video. So, Ocean Keys Family Practice has a comprehensive results follow-up system where all the correspondence comes in to a central location called the patient's holding file. So that includes all electronic correspondence, which is test results from pathology or radiology or scan correspondence that comes in from specialists. They all come into the patient's holding file. Scan correspondence is normally scanned upon receipt by the reception staff and are allocated according to the patient's name and the doctor who last saw the patient. So I'm just going to open up the patient's holding file here. So if you go to the correspondence menu at the top, there's check holding file, and if you click on that, it'll call up a list of all the practitioners, all the doctors that have outstanding test results or outstanding correspondence that hasn't been okayed or actioned. So when you get that list, if you could click on all the different versions of yourself and any other doctors that you're covering for. So I'm just going to click on myself for now, and what that'll do is it'll call up a list of all the different test results and correspondence that's come in. You can see up the top there's the list of all the patients and the test and the subject test result or the person that we've corresponded with, and then underneath at the bottom here there's a window that gives you an idea of what the test result is all about. So for this one, this is a letter that's come in from a specialist, and have a look at the letter or the test result. So you've got all sorts of things here in ECG, other correspondence, histopathology, blood test results, and then decide what you want to do with it. So how you decide is you use a series of these buttons here. There's no action for the tests that don't require any further action, and they're generally the normal tests or tests where the appropriate treatment has already been started. There's discuss, and what happens when you mark a result as discuss is that the reception staff will then collect a list of all those tests, and then they will attempt to get in contact with the patient. So they'll normally check the upcoming appointment and flag it as being a result appointment if it is a result, or alternatively they will get in contact with the patient either by SMS or by letter. So that's discuss. And then the third button is return urgently. Now, return urgently is for those very, very serious things such as an abnormal troponin or abnormal D-dimer, and it's probably most appropriate for the doctor to make contact with the patient directly. A button that I use quite frequently is this action button. So if you click on action, it allows you to, not so much in that one, but if you click on action, it allows you to either indicate the same notations, but it allows you to indicate the same notations, but it also allows you to write a comment. And you can sort of see, according to my list of comments, that there's some standard things that I say. Often a time frame for when you want the patient to come back is a really, really helpful thing. So that's how you work your way through that list. And then just look at each result in turn and work your way to the bottom of the list. And then when you reach the bottom of the list, if you close this window, it will save all those changes that you've made. So that's how you check your results.